And here we are, back again, episode 3. So,
today, my favorite human, Julie Scott. She's coming to talk to us about, she could talk to us about 8 topics. She's so smart, and she's involved in so many things. But today, women's health. So she's going to be up first, and then we have another guest.
Yes, we have Nick LaMarca from, I don't think it's called Voluntary Services anymore. They call it something else, but he'll talk about that.
He'll correct you. I think he's still reading it off his new mug, the title.
He's got a fun job.
He does.
And then, you know, I wanted to talk about something that's kind of been bothering me.
What's going on?
It's been bothering me for a couple months. And
today's the day, apparently.
I don't want to lose sleep over it anymore.
Oh, no.
Taco Tuesday.
What's Taco Tuesday?
It doesn't exist anymore. They stopped Taco Tuesday. And I know everybody out there is in agreement with me.
So who stopped Taco Tuesday?
Apparently in the canteen. They just stopped doing it.
There's no more Taco Tuesday in this building.
No, not unless you bring the tacos in.
Have you seen Lamar, one of the NBA guys? He has this Taco Tuesday video that he does with his kids, like, Taco Tuesday!
Taco Tuesday!
No, I haven't seen it.
Oh, well,
you
know what?
have to show me it later.
It is great.
But this is serious.
Oh, okay.
You're like trying to
why are they
make
not
fun of it, but
taking...
it's serious. I think we need to start a petition.
I think we could start a petition.
And I think we probably could get pretty much everybody in the hospital to sign it.
I think if they're watching our podcast, which you better be watching our podcast.
Right. Taco Tuesday.
Taco Tuesday. Do you know that's my favorite food?
I love tacos.
How many tacos?
You know what I liked about Taco Tuesday is every Tuesday we could count on Taco Tuesday. And when I worked in EMS, I know I'm in public affairs now, but when we worked in EMS, we would all sit down together and we would all enjoy our tacos.
Do you know how much they were when I was in high school?
You're going to reveal your age.
2 tacos for $1.
That's great.
And if you know where a Taco John's is in New York, let me know, because that was my favorite. And they're a Midwest thing. So now you have to go to Mighty Taco.
Taco Bell.
Taco Bell.
Okay.
Moe's.
Yeah.
But yes, we are starting a petition. Mark our words. Today it starts a petition to get Taco Tuesday back.
And I think we should pick it walk back and forth in front of the cafeteria too.
I am a nurse and I'm not allowed to pick
Tuesdays.
it. Okay,
enough.
But now,
enough of Taco Tuesday. I'm going to get 1,000 emails now, which is great.
You are. I hope you do. Spell your last name, because that's difficult.
So here it is. We're in June.
Yes.
You walked the Pride Parade. Was it fun?
I did. I got a little misty. It was warm.
I had
possibly rained.
I had fun.
But it was fun.
It was fun walking with you.
Lots of live music, lots of dancing in the street.
Lots of
Characters. I saw some really fun people. It was great.
It was a good time. And then, so also next week, Juneteenth is coming up.
Yes.
So they have the picnic in the park, down in Veterans Park on Wednesday. I believe it's Wednesday.
I think, because the actual day of Juneteenth, we're all off. It's a federal holiday, and that's the day of giving and caring for Bailey Avenue.
Yeah.
And so then they are having it on the Wednesday, the picnic. So, again, food, which is my entire summer.
And they work really hard to put that together.
They do. And
so looking forward to that.
Yep. So we can celebrate Juneteenth as a community of love and unity.
All right, so let's bring on our first guest.
Come on, Julie. We're so glad to have Julie Scott with us today. How about starting her off with some hard questions?
Okay.
I love that you brought your own tea.
I thought it was only appropriate.
That's awesome.
Cuppa Joe and tea with Melissa and Julie.
Yes.
Oh, we could just bring you in full time.
All right, let's get started.
All right, let's get started.
All right, so Julie, tell us, why did you choose to work in women's health clinic, and what's your role?
Okay, so I love women's health. It's always been a passion of mine since nursing school, and when I was in the Army, I did 4 years, and most of it was in women's health care. It was labor and delivery and some other things. So when I came to the VA and they told me a job was available in women's health, I said, perfect. So I've been mostly in women's health here, and I do, as a women veteran, I just feel you know, it's just a great place to be, and I want to help other women veterans. It helps me stay connected to that women veteran community.
Yeah.
So my role right now is I'm the GYN RN care coordinator. So it's a new position funded by, we call it WISE funding, but it's like Women's Health Improvement funding. And what I do is work with our gynecologist, and I am his triage RN. I give test results. I help make sure we're all set for surgeries and things like that. So it's been really exciting. And then I'm also covering as the Women Veteran Program Manager.
So
Awesome.
she's very much versatile in anything she does. She can help out anywhere. I noticed that. What are the different services that the Women's Health Center clinic can offer veterans?
So we have really quite a robust women's program, which is pretty awesome. If we remember back to even 15 years ago, it's grown so much. So we do primary care in our women's clinic, which is on the 3rd floor, and we also have GYN services. And our primary care, we call it comprehensive women's health care. So you don't have to go to 2 providers. You don't have to go to your primary care provider and then also to a GYN to get your pap smear. You can do it all in the same shop. So and so we do that up here in the women's clinic. We encourage all of our women veterans to come to a women's health provider. So that's a primary care provider who's trained in women's health, and we want them to be with those specific providers. So we offer that opportunity not just in our women's clinic, but also at all of our CBOCs and in our 2 primary care clinics located on the 1st and 4th floors.
True.
So how would an employee refer somebody to the women's health clinic?
So if an employee is talking to a veteran who's not enrolled, they should enroll through the Veteran Service Center, and then they will get connected with their first appointment. And the primary care call center is another way. They can call directly to the primary care call center, and they will just let them know, I'm a women veteran and I want to be seen, you know, for primary care, and they are trained to set them up with a women's health provider. So they will
Awesome.
offer
Great.
that to them.
Yeah. How many providers are there? I forgot.
In women's clinic,
Yeah.
we have 3.
Okay.
We have 2 doctors and a nurse practitioner.
Okay, that's right. What would you say is the most important information employees should know about women's health?
I think it's important for employees to know that there are special services for women. Over the years, people have run into me in the elevator. I tell them where I work. They say, I didn't know we had a women's health clinic. And I'm like, yep,
Yes,
it's
we
on the
do.
3rd floor. So we educate our staff at new employee orientation, and we let them know about all our services. But it's important to know that care throughout the VA has changed. So we have our women's clinic on the 3rd floor, but we also have a 3D mammography suite in radiology. We offer,
That's
you know, specific testing for women. We can offer, you know, different cultures. So lab had to change, and nuclear medicine had to change to offer different tests, and radiology had to change, and our all of our hospital floors had to change to accommodate female patients. So it has, you know, our care for women veterans has just exploded over the years, and we have made so many changes to accommodate them, to make them feel welcomed here, to give them that privacy and dignity that they deserve. So
That's great.
That's good.
So how would an employee contact you or someone in the women's health clinic?
So to contact the Women's Health Clinic, they can call the primary care call center, so at 862-8567. But to contact me or the Women Veteran Program Manager, our number is 862-8891.
One more question. I hear there's someone new in women's health.
Yes, so we hired a new Women Veteran Program Manager, and her name is Stephanie Davis. She started 2 weeks ago.
Nice.
Yeah, she's
We're
doing
gonna-
great, and we're
Come on out,
introducing
Stephanie.
her to
Come on.
everybody.
Come on in and say hi. Hi, Stephanie.
There's Stephanie. Hi.
We're so glad that you joined us. She's fresh off the streets of Buffalo.
Straight off the
Straight
streets.
out of the So when where did you work before?
I am coming from Millard Fillmore Suburban Hospital. I was the
Wow.
OR manager there for about 5 years. I've been in healthcare for about 20 years, doing a variety of different roles, from floor nursing to clinic work to leadership and so forth.
That's wonderful. Well, thank you for coming and joining us.
We're so happy to have you
We're
with
going
us.
to
Welcome.
torture Julie a little longer here.
Yes, thank you. Bye.
Yes. Well, Julie, this is our part in the show that we try not to tell everybody about unless you've watched the podcast. We like to call this segment
Four Questions. And here they are. It's just like magic.
It is.
You're lucky it didn't hit you in the face.
I did the last person.
So you're going to pick 4 questions. Give her 2, give me 2.
Don't look at him.
And the only rule is you have to answer them.
Oh gosh. Okay.
How good did you pick?
Oh boy. All right, here we go.
Well, okay. All right, so treadmill or elliptical?
Ooh, treadmill.
Oh, okay.
Nice.
Yeah.
Pool or pond?
Pond.
Really?
What?
I have one.
Nice.
You have a pond? Mm-hmm. I'm coming over. TV or movie theater?
TV.
Okay.
Agree.
This one's
Pretty
tough.
much can make your own movie
Your
theater at home.
toughest question. Strawberries or raspberries?
Raspberries.
Oh.
Wow, this girl's different. I like it.
I like it. I like it too. It's all that women's health getting into her. Like, I have raspberries. Very fancy.
Thank you so much for being here.
Thank you for having me.
I can't believe you're also going to be taking a new job in the national level.
Yes,
Soon?
out of VA, New Jersey, out of the RISC. So
Okay.
that's the War-Related Injury and Illness Study Center, and I'm going to be a nurse expert for a year.
I told
Good
you,
luck to
she's
you.
super
Thank
smart.
you.
Keep in
Nurse
touch.
expert.
I will.
Oh, yeah. Thank you very much. It was a great interview with Julie Scott.
Oh, Julie's awesome.
She really is. She has a lot of stories, too, from when she was in the military.
Mm-hmm.
So, but we have another guest coming up.
Nick LaMarca
I know.
from
Nick
the
is...
CDCE, and I'll let him explain
I
that
know.
in the interview.
All these long titles are killing me.
I can't wait. And we're back with Nick LaMarca. Thank you for joining us.
Good to have you.
Nick is in charge of voluntary services. They changed the whole name of that though, didn't they? It's
We're now the VA Center for Community Development and Civic Engagement.
that's a mouthful.
It is.
It's almost as worse as the other one we had that was really long and I couldn't say it. I'm glad I didn't get that question.
Almost as bad as my last name.
True. Yeah. Could be something easier. So what does the CDCE do?
The whole purpose of us at the CDC is essentially to make it more comfortable for the veterans we serve here out of the hospital, whether it's our clothing room when veterans need clothing, whether it's events we hold celebrations when we're coming out of COVID, or holiday observances. We have volunteers that are our DAV transport network that go and pick up veterans that need rides for their appointments. We have escorts that wheel inpatient veterans to their different appointments in the hospital. They escort veterans coming in who might need a little help being pushed in the wheelchair, or whose spouse probably should be in a wheelchair who's trying to push them, and stuff along those lines. We have volunteers over in the research building. We have volunteers over actually down in logistics. So we're throughout the hospital. But the main purpose is to kind of make the hospital a better place for the veterans coming in a bunch of different ways.
Nice.
So Nick, what drove you to the role of voluntary service officer?
I had always been involved in community and organizations. The job came up. I read the job description. I read the mission. It seemed very interesting. Something that would be right up my alley, especially with all the community work that I'd done in the past. I had great timing for it. It was, I took out the job on June right before COVID. So I always kind of say this is really my first year in the job because there were a lot of things I wasn't able to do during COVID for obvious reasons.
You're a veteran?
Yes.
Where did you serve?
A lot of different places.
A lot of different
A
places?
lot of different places.
Army, though. I'm
Army.
sure. Army all the way. I can
Army
tell.
all the way.
Army. All right. Well, what if an employee wants to be a volunteer? Is that possible?
Yes, we actually have a few employees that have volunteered currently and in the past. Most of our volunteer opportunities for regular volunteers tends to be during day shift hours, so sometimes it's tough for day shifters, regular volunteers, but we do have employees that they volunteer with our recreational therapy department during the evening diversionals when the different groups will come in and do stuff. I know there's a couple employees that have volunteered in the past to help on Sundays when they do the Bill's watch parties for the inpatients,
Oh, yeah.
and special events they can help.
Who runs bingo? Is that your department?
The organizations that want to do the bingo link with us first, and then they link with recreational therapy to set that up. That really is rec therapy that runs the actual events
Okay.
and does all that stuff.
I heard it overhead one day, and I thought,
Yeah, that's
wait a minute.
that's recreational that's recreational therapy.
All
So
right.
the volunteers in process with us, but that's recreational therapy plans that, gets the veterans there and runs it.
Nice. Okay.
So how do employees contact you or someone from the CDCE?
Well, if they're in Buffalo, it's Faith Domowitz or myself. And if there's Batavia, it's Cindy Baker or myself. I also have Anitria Foster as our assistant. But the best way, if you're an employee, to get a hold of us is if you're in Buffalo to email, and Batavia email as well. Because then we can make sure that we get back to you.
Great.
Email or Teams. And
We'll put that up on the slide for people to see. And
Yeah.
I just want to mention Faith is provided primary care, an amazing volunteer.
oh yes, she's
So-
I know. She's
Yeah.
she's a very good volunteer.
Yeah, we didn't have a volunteer in primary care for many years, apparently. And
Yes.
I was like, yes, we need a volunteer. We'd always use a volunteer. So we've had really good luck, and the veterans love her. So it's very nice to have her there.
And not to leave Batavia out, we do have the same opportunities
They-
for employees to volunteer out there.
That's nice.
Yeah,
That's
and-
good.
yeah.
Yeah, because Batavia, Bruce will maybe beat me up if I
No.
don't mention him.
Cindy might too for me, but the volunteers we have out there really get the veterans to all their inpatient appointments, and we have a
Good.
DAV transport network out there too.
Yeah, it's super wonderful to have the volunteers. They help us all get our jobs done a little bit better. Well, thank you for coming today, and do you have any other questions that you can think of?
He's not off the hook yet.
Oh, what do we have for him? What is it that we have? 4 questions!
You're lucky she didn't hit you in the face.
On a Friday, all
Oh,
right.
on
Well-
a Friday.
Well, they're watching it on a Monday.
Oh,
So,
that's just as bad.
so here's the rule. You got to answer the question. Pick 4, give her 2, give me 2.
Okay. All right.
This is my
I
favorite part of
promise
the
it'll
show.
be painless.
It'll be painful.
It'll be very painful.
It's going to be
two.
painlessly painful. Oh,
two.
I,
All right,
I already know. Oh, this. So first of all, let me say, before the show, sometimes we have conversations, and this one I may already know the answer to, based on our earlier conversation.
Okay.
Football, or baseball?
To play and coach baseball, to watch probably football.
All right, we'll let you slide on that one.
Okay. Steam sauna or dry sauna?
Dry. I wear glasses, so my glasses would steam up, and I can't see well without
That's a
them.
good answer.
I'm going to let you go next because I have the perfect ending with
Okay.
this. Now you're nervous too, aren't you?
Oh, salty, sweet, or savory?
Sweet.
Sweet. That's what I said all day long.
Sweet.
Anything. All right. Earlier, we had a couple shows back where we started a petition for Taco Tuesday.
Taco Tuesday.
So did you sign the petition?
I didn't know one
petition?
existed, but I would. I miss Taco Tuesday.
I missed another one. So is it tacos or burritos your favorite?
I like soft shell burritos.
Really?
Yeah, I do like
So
the
does
soft
my
shell better.
husband. Well, I love tacos. You love tacos.
I like yeah.
And now we know
They sell the combo packs.
he's a burrito man. So thank you for joining us.
Yes, and
What
I
is
just
up
want
with
to
taco?
I just want to say
Yeah.
we film on Fridays.
Yes.
And both of us are wearing red shirts, and that's for a reason. If
Yeah, what
people
is
don't
that?
know that,
What is it for?
you wear the red for those that are serving overseas,
Okay.
and also
The POWs and the KIAs.
I
so
didn't
that's
know
why
that.
if you see us all wearing red on Fridays, that's why.
And they did call each other this morning and ask each other to wear red.
No, that was Wednesday.
All
That was
right.
Wednesday.
Thanks for coming.
Coming.
We appreciate your time.
Thanks, Nick.
All
deal.
right. See you next episode.
Bye bye.
Bye.